how are you and your team managing your own personal approach to this and how you structure your days and where you get your rest and how you're able to do this the way you're doing it on a 7-day week period basis?
Look, Lawrence, there's no answer to that question. You do what you have to do, right? As I mentioned, I was in the federal government. So you respond to the crisis at the time, whether it was Hurricane Andrew in Homestead, Florida, or the Midwest floods, the Los Angeles earthquake we went through. I did the disaster relief during the Clinton administration, the rebuilding in Haiti and in the Dominican Republic. You do what you have to do. The adrenaline kicks in, and that's the job, and that's what you signed up for, just the way they put you on a plane and tell you, you're going to go out and cover this. Now, this is going to be a longer period of time, and I am worried about that. So I am rotating my team, and we have like an A, B, and a C team, because no one can do this 7 days a week at this intensity, 24 hours a day for 4, 5, 6 weeks. So we will rotate people. But this is, you're right, this is government being called on to perform in a way it hasn't probably in most people's lifetimes, right? This is a full-blown nationwide crisis where government has to work, Lawrence. This is not abstract. It's not theoretical. We're not talking about policies. You have to make that government operate, and it has to operate in a way it never did. You have to take those hospitals and make them work together in a way they never have. You have to produce those supplies. You have to find those gowns, find those masks. You have to have those ventilators. You have to be able to move patients back and forth, and not on a flow chart, but in a car, on a road. And it has to happen. And if government doesn't work, people will die who didn't need to die. So you see this whole shift, Lawrence, from this abstract political conceptual discussion, wouldn't it be a great idea if government did this, to the exact opposite spectrum. This is all practical, this is all real, this is all experience, this is all competence, this is all capacity. And can you get that government machine to work? That's what you see the federal government struggling with, right? Can you get FDA to work with CDC? Where is FEMA? Should they have been buying supplies? How do they do it? Where does HHS fit in? You see these government agencies now trying to perform, but that is the real test for government. And for me, I very much believe my way is to be out there, Lawrence. I say to my National Guard on every disaster the same thing. I'm not going to ask you to go anywhere that I don't go. And I'm not going to ask you to do anything that I don't do myself. And I don't care if it's a flood, if it's a snowstorm, whatever it is. If I'm going to ask someone else to go out there, personally, I need to go there. I'm just not comfortable sitting in the office and sending someone out who has a family, who could be in a position of danger, unless I would put myself there. And that's personal, and in this situation, my healthcare advisor says, don't do that, it's a mistake. But I can't operate any other way. So I'm out there, I'm visiting the facilities we're setting up, I'm working with the staff, I want to talk to people the best I can. I'm trying to calm people down and explain facts, because everybody gets 57 different versions of the facts during the day. That's how I see my role. At night, we get the results from the hospitals and we start to study the data to see if we can find any patterns, because I'm still looking for that apex of the curve. That's where the enemy is going to join us. And I want to make sure we win at the top of that mountain. So we're still on the way up on the trajectory, and we're studying the data to see on the rise of cases, the rise of ICU beds, what is that challenge going to be at that high point? How over capacity will our system be? How many ventilators will I need? How many ambulances will I need? How many hospitals will I need? And that's what we do as a planning exercise during the evening hours.